Hello, everybody. It's Kelly from the Hub. I am here with 4 women who work at CAP, all in different areas of this wonderful organization. They are partners of us with the Northern Lancaster Hub, and we are going to talk about all the things that they do, whether it's utility assistance or domestic violence or WIC or children's programming. We've got a lot of, or food assistance. We've got a lot of programs here to talk about in one of the coolest organizations in the whole county. So
fair.
It's fair. That's fair. Absolutely. So let's chat about how this is. First of all, CAP is open. CAP has been open in all the parts. It might look a little different. COVID kicked you around a little bit like it's done all of us, but you guys are working some home, some remote, some in the office. So CAP is open. So let's talk about that in more detail. Kim, do you want to go first? You are in charge of the whole WIC program.
Among other things.
Among other things, absolutely, yeah. Absolutely.
Yeah.
So how is that working for you?
It's actually been going very well. I mean, it took a while. I'm not going to deny it. And I just kept ordering hand sanitizer and gloves and still am, but we were able to keep the Lancaster WIC office open. I did have to shuttle all the county offices, all of our outreach areas, and our mobile clinic, just because we just couldn't keep them open. Some WIC offices around the state are doing mail certifications and mailing people's cards, but I felt that in Lancaster we could make it work with in-person card reloads.
And how's that working?
It's working great.
It's thank goodness.
Much, yeah. It's a little bit safer as far as the people getting their benefits quicker and something not getting lost in the mail. But CAP was able to help us out and put plexiglass in our lobby so that I can assign 2 individuals to what we call load and go cards. We hit our 3,000th card reload this week. So that's how many families have gotten benefits since March 17th when we first started this. So that's really impressive. And it's just way to go for our staff. We're doing a lot of work up front on the phones, and we're not really able to give much nutrition information or education, but people are getting their food benefits, and that has worked out great.
Let me ask this question. I know that part of that process also was to do a blood test for the kiddos. That part has been put on hold as well.
Right, that's waived, but whenever we can get those levels from the doctor, we get it. We get heights, weights, and hemoglobin levels from physicians' offices, and they've been very eager to provide that for us.
Wonderful. So, what's in the works next for opening up in other places? That might be too soon to ask the question because everything changes daily, weekly. So, what are thoughts about what's coming up soon?
So for us, even when we go into the yellow phase, I think we're going to look almost exactly like we look now. For my staff, for WIC, I have only about 12 people on site every day. Other people are either working from home or they're just home. So we have very few staff in the building. Actually, in the whole building, we have very few staff. Almost everyone else is working from home in the organization.
Excellent.
One thing, though, I do want to mention to get the word out for people is we absolutely have to have a valid phone number for you. We're calling every single person at least once in advance of the appointment so that they know exactly what to bring in. If we can't get a hold of you, then when you come in, it's possible it could take a little longer, or we might have to send you out to your car and call you in your car with your updated phone number. So it's just so critical that we have your phone number, or we're really stuck in trying to help you.
We are seeing an increase of people who are new to social services. So if they are new to the WIC program, how do they start this? Because they might know nothing about how to even start the whole thing.
Well, I think the easiest to remember is pawic.com.
Good.
The website you can go to. Once you get to that website, it talks about eligibility. Essentially, anyone who is receiving medical assistance or SNAP benefits is automatically income eligible. Some of the benefits that people are receiving under the stimulus package count, some don't. In those cases, individuals have to be under 185% of poverty level. At the PA WIC site, you can find all that information, or our phone number for scheduling is 717-509-3686.
Perfect. That sounds great. That's good. That's perfect to be able to know, because we don't know who's going to be accessing these services now. So it's good to be able to do that. Awesome. Yep. Thank you very much.
So before we switch,
sure.
I also really want to talk about food distribution, because that's another biggie.
Good.
So CAP is the lead agency for state and federal food distribution in Lancaster County. We have a network, and as I talked before, we love our networks. We have a network of 33 pantries and 3 soup kitchens and 1 shelter. And so we distribute food to those organizations either directly from our warehouse or through Central PA Food Bank. We have been packing over 1,000 boxes of pre-packed distribution boxes every week in our warehouse. We've used folks from Aurelius's team, staff from other teams who don't have work to do right now. And we went from 0 boxes on March 16th to about 1,000 a week. And that's a huge change for us. So again, with food distribution, normally there's an income level, but the feds have waived that level through June, well, through the beginning of June, through the end of May. You don't have to do paperwork, you just have to show up and get food.
That's good to know.
In your area, Kelly, the 3 that come to mind that CAP supports is Ephrata Area Social Services, Peters Porch Denver, and our Mother Perpetual Help.
Perfect. That's wonderful. Yep. Thank you very much for that.
One more thing.
There's more things.
Yeah, there's one. The best way to find food distribution sites really is to go to PA 211. That's the United Way site, and just plug in Lancaster County, and you can find out all of CAP sites as well as other sites that distribute food that are listed there.
Wonderful. Thank you very much.
Yep.
All right, beautiful women. Let's pick on the next volunteer. Aurelius, talk to us about all the stuff that that your team is working on. You do a lot. You have a lot of parts as well that you're in charge of.
Sure. So my name's Aurelius Perez. I'm the House of Stability Impact Team Leader at CAP. I oversee multiple programs, including Early Learning Resource Center, Utility Assistance, Navigation, Chrysosatics, Community Center, and Capital Construction.
So tell me a couple of things that you're in charge of.
So I will highlight a couple of those teams. So the Early Learning Resource Center, we are the folks that process child care subsidies for Lancaster County and Lebanon County. And folks can still apply for subsidies if they're essential workers and they're frontline workers. So please know staff are still working remotely on processing those applications. We can also support people in finding a child care center that is open with a waiver that can take care of their children while they're at work. So that's really important for folks to know that service is still ongoing for our essential and frontline workers. And then for utility assistance, as many of you, as you know, Kelly, and I'm sure most people do, there is an extension of that moratorium that was put in place by the PUC. That's going to remain in effect through Governor Wolf's proclamation of disaster. That being said, though, we are still encouraging folks, if they need utility assistance, to apply. So that way we can get you on one of our programs that most aligns with your needs and get you situated so you don't have to wait until that moratorium is lifted. We want to make sure that people are not getting behind on their bills and that they can still receive that service. Our utility assistance team are available remotely. Income documents, applications are available on our website. They can be emailed to us at ontrack@caplank.org. We are providing this service for PPNL and UGI users. For PPNL specifically, we're working with people who live in Lancaster, Chester, York, Berks, and Lehigh counties. So please reach out and know that some of those programs, for PPNL specifically, they've extended and upped the qualifying income guideline so that more folks can qualify during this time. And then for Crispus Attucks, so Crispus Attucks has shifted their programming to focus mostly 100% on food distribution. So we serve hot lunches every Tuesday and Thursday from 11 to noon, and that is open to anyone in the community to come by. It's grab and go style. We are maintaining, the social distancing, making sure that people are coming in wearing masks, picking up their lunches and heading on out. So before the pandemic, we were serving about 480 meals a month, and that has increased to about 800 meals a month. So we've definitely seen a significant need there. And then food pantry, we were doing that twice a month before the pandemic and serving about 300 families. We have shifted to distribute food pantry boxes every Wednesday between 2 and 6, and we're serving about 1,000 families a month. So if anyone can come by and access that service, just as Kim explained. And then navigation is still working with their clients, and they're continuing that work. And capital construction, as Kim has mentioned, has been assisting with food distribution, supporting some of our other programs at CAP, and they have started back on construction jobs since the construction has opened.
Wonderful. I did want to ask about this. So the utility moratorium is until June 4th at this point, right? Is that still part of what that date is?
So it's until the proclamation of disaster is lifted by the governor. Yeah.
All right. Yeah, that's what I thought. I just wanted to make sure. I know that one of those things that people might not really know is that moratorium doesn't mean that your utility bills go away. It just means that your utility bills, you could choose to not pay them. But
they're not going to shut off your service, essentially.
Correct. But when the moratorium is lifted, if you haven't been paying, all of those bills still accrue, right? Is that how that works?
Yes.
Okay.
Yep. So
people could run into some stumbling blocks after that happens.
Correct. Yep.
Okay.
That's why we're really encouraging folks to reach out. And if you are unsure if you qualify, for any of the programs, reach out anyway, because that's why we have staff. We have our team and staff that can guide you through that process. And if for some reason we're unable to help you, we do resource and referring to other assistants and agencies that maybe can. So super important that folks continue to seek assistance with their utility bills if that's something they need right now.
Absolutely. Good. Oh, that's wonderful. It feels like I have this list in my head of, can people get food? Can people make sure that they can have, utilities? And I'm like checking off all these lists, and this is just so good, because this makes this hard part a little easier when you know how to navigate all the parts. And so that's why this is perfect. All right, so we're going to move over to you, Amanda, and we're going to talk about some education resources for some of the kiddos out there. So tell us what's going on. How are things?
Yes, I'm Amanda Burns, and I lead the Education and Child Development Impact Team. So how things are going, so just for background, we offer infant through pre-K services through center-based, home-based, or home visiting through the programs that we offer. So right now, we're grateful for the support from our funders to be able to provide virtual learning at home or virtual home visiting at home. So our teachers, our family development specialists, our advocates are either doing phone calls weekly or doing these virtual home visits and virtual learning opportunities. So yeah.
That's wonderful. And as this is progressing, how are you sort of seeing what the future, at least the next couple of months or the next, season might hold? How are things changing for you guys?
Yeah, so we're listening, we're following, things that are coming from the governor, from Pedro Rivera. We're doing a lot of learning on what reopening could look like as we move into the yellow phase. For our county, I believe a lot of our services will still continue virtually. However, we will, and we are right now already planning on how does this look for the working families who we provide all-day care for. So we're in the process of exploring what safety precautions need to be put in place, what procedures, how do we train our staff. So we don't have a timeline, obviously, but we are planning.
Excellent. I know that in lots of conversations, people are thinking to themselves, all right, if I need to go to work, I have to have childcare. How do you teach a 3-year-old to socially distance? And so you're right, this is creating a lot of creative planning, not just for pre-K, but certainly K-12 and all that kind of stuff too. So awesome. Thank you, Amanda. That's very helpful. And I'm sure we will talk more about that as well. Lovely.
Yeah, and we are enrolling for next year. So anyone
Excellent.
Would like to enroll, we still are accepting applications for the 2021 program year. So anyone who is interested in enrolling or needs infant through pre-K care all day, or if they just need a 6-hour day for pre-K, they might qualify using the federal poverty guidelines. We do offer and have free, we have private pay spots, and we also have free services that, we can provide. So calling CAP, asking for our enrollment specialist would be a good next step so that, we can begin to plan for the fall, and, those who might need our services, we can get you in.
That's wonderful. I just want to make sure that we can talk in the future, because I've got a couple of ideas that I need both you and Aurelis about early education on, so that we should definitely talk about that. Christine, hello. You are also part of CAP, and you deal with domestic violence services and all of the work surrounding that. So hello, how are you doing at this time?
But doing well, all things considered.
Good, good. So I think everybody's been talking about it, and so if you want to let us know about how you're sort of seeing this in the world. When we started this whole thing, it was looking like no one was making phone calls to domestic violence hotlines, and people were concerned that violence issues were up. And is that what you saw here too?
It is what we experienced, and not only that, but I'm on calls every week with the centers across the state, and they all experience some version of the same thing, at least in the beginning, that their calls were way down, their requests for shelter were way down. And we talked a lot about why we thought that might be the case. And I think that when we're told to stay at home, and when we're at home with the person who controls us, it's very difficult to think about how you're going to leave the house to do something that would be flying directly in the face of what that person would want you to do, or the way you're being controlled by that person. So I think that because the calls have started to increase again, and that's also true across the state, we recognize that after the new normal settled in, people started to realize that services were still available out there, that all of the programs were still up and running, their hotlines were still up and running. Most of they're sheltering in some way, whether it's in their buildings or in hotels. That word started to get out. I think that more programs made an effort to get that word out through police departments and hospitals and other social media and other ways to get the information out. And by, I think, the 1st of May, we were pretty much back to the regular volume of hotline calls and requests for shelter and so forth.
So if someone isn't aware, they can still get a PFA, and that still goes through the court system like it had been before, and that part hasn't really changed, right?
Well, there are some changes. They can get a temporary PFA, they can get an emergency PFA or a temporary PFA, but what is not happening right now are the final PFA hearings. So the temporary PFA just remains in effect until the final hearing is able to be scheduled, which could be June or July, because I think the last time our legal director checked, there was a backlog of 170 PFA cases that needed to go to final hearings. So that means 170 people are walking around with the temporary order, which has all of the same protections in it, but it's not finalized because a hearing hasn't been held yet. So
Right, because just like utilities, all of those things were just piling up, and we had to wait till the system opened in order to be able to hear those cases. Yeah.
right, and the courts are closed through the end of May and into June now. So they're already talking about how are they going to process the backlog of cases. It also makes victims nervous to know that the PFA is a temporary PFA, even though it has the same protections as a final order. I think the idea that it's temporary and that the hearing hasn't taken place yet contributes to anxiety and stress that victims are feeling about it if they've ventured out to get it in the first place, which means they have to go, pretty much have to go in person to the courthouse to do that.
If someone needs assistance, either through your legal service that you have or for shelter, they should just go onto the website. There's a section that says if you have domestic violence concerns, and they can just call or they can email that way, right? Is that the best way for you guys?
Right. So all of the legal clinic staff is working remotely except for the advocate who's stationed at the courthouse. The rest are answering phones, meeting with clients remotely. You can still call the legal clinic number, which is 717-291-5826. And someone will either answer that call right away or return that call very quickly, and they'll talk someone through. Sometimes people just have questions. They don't know if the system is still operating, but they'll talk them through what their options are at this point.
I gotta say, ladies, this has been wonderful to be able to know that all of these things never stopped, kept going. We adapted, we changed, we made it work all around. Anything you guys want to end on to let people know about? I mean, the world of CAP is good and big. At Christine, absolutely.
We should let everyone know that our hotline, our crisis hotline is up and running 24/7 as it always does. You can get answers to your questions there or just get support or safety planning. And that we also launched a text hotline because, you know, if you're trapped at home with the abuser and you can't talk out loud on the phone, you could potentially go into the bathroom and send a text and get some support that way. So you text the word SAFE to 61222, and that'll connect you directly to an advocate who is also the hotline operator.
Perfect. We will post all of these numbers in separate posts as well so that people have access to each of these individual things too, so that they know how to access all of these kinds of services.
Kelly, I would like to add that
Sure.
I think it's important for all of our constituents, all the people we come in contact with, to just not expect anything to change anytime soon. And that when we do open up for what's now going to be our new normal, I think we're all going to look very different. I don't think people can expect to walk into a WIC clinic anymore and see the open areas, the child play areas, have one-on-one interactions with a nutritionist. I think we'll be doing those same things in a different format, but I think people should get in their heads that it's not going to be business as usual.
However, they will still get the services that they need and want. No matter what it looks like, they're still going to be able to get all the things.
Right. It's just going to look different.
Absolutely. Good.
I would also say, Kelly, for folks to continue checking our website, we put updates on our website, Facebook, Instagram. We're really active on social media. So that is where you're going to get a lot of information. And then you can also connect with us if you need more questions. We have folks monitoring questions that come through our website, and then they get disseminated to the different programs. So those are good ways to keep up to date with CAP news and CAP services.
That's wonderful. This is what good partnership is, because this means we can talk to each other and know how things work and be able to help people in a much easier way all across the county. So, ladies, As always, thank you very much for all of your help. I will say goodbye to my audience at home. See you, everybody, and we'll probably check in with all these beautiful women again.
Thanks, Kelly.
Thank you.
Thanks, bye.